The hidden enemy in your medicine cabinet. Have you ever wondered if your daily medications could be silently destroying your heart? Could the pills you trust to heal actually be leading you toward cardiac failure? What if the very remedies prescribed by doctors carry invisible cardiovascular dangers? More than 64 million people worldwide live with heart failure today. This staggering number continues to rise every single year without slowing down. Many cases link directly to medications people consume daily for common conditions. Heart failure presents different clinical forms and carries high morbidity and mortality rates. It reduces autonomy and functionality, while negatively affecting overall quality of life significantly. This condition can progress rapidly and worsen until it causes death unexpectedly. However, it can also stabilize or improve depending on underlying causes. When thinking about heart disease, we usually associate it with previous conditions. We think about high cholesterol or genetic predispositions as primary culprits only. Rarely do we consider that routine medications might be damaging our hearts. How can certain drugs induce heart failure in otherwise healthy individuals? Which medications represent the greatest risk to your cardiovascular system, and why? Is it possible to prevent this damage while treating chronic conditions long-term? Stay until the end to discover how healing one condition destroys another. Let's begin. When pain relief becomes a heart threat. Non-steroidal anti-inflammatory drugs are among the most widely used medications globally. They treat pain and inflammation effectively, but carry significant cardiovascular risks nobody discusses. Some of these drugs can negatively affect heart health by increasing risks dramatically. They raise the probability of myocardial infarction or cerebrovascular accidents significantly. Among the most common are ibuprofen and naproxen, available without prescriptions anywhere. This easy availability increases consumption and consequently elevates cardiovascular event risks substantially. In 2005, the FDA issued warnings about cardiovascular risks with ibuprofen. In 2015, after expert panel review, they reinforced these warnings strongly. The risks stem from effects on blood pressure and cardiovascular system function. Other options within this class include celecoxib diclofenac and aspirin with different profiles. Aspirin does not increase cardiovascular risk and is actually used preventively today. However, caution is essential with drugs like ibuprofen, ketoprofen ketorolac, and diclofenac. These medications can elevate blood pressure and contribute to serious cardiovascular problems. Rofecoxib was particularly dangerous, causing 140,000 heart attacks annually. The FDA approved it in 1999 for osteoarthritis and inflammatory conditions. Its use expanded rapidly because it presented fewer gastrointestinal effects than alternatives. In 2004, the pharmaceutical company withdrew it from the market permanently. This came after demonstrating significant increases in cardiovascular event risks for users. During 5 years of availability, it caused approximately 140,000 attacks. These numbers represent only United States cases and exclude international damage entirely. The drug acted by selectively inhibiting cyclooxygenase 2 enzyme with dangerous consequences. This mechanism is shared by other drugs like etoricoxib, celecoxib, and valdecoxib. 1. Take the lowest effective dose possible and limit treatment duration always. 2. Never combine more than one NSAID at the same time under circumstances. 3. Consider non-NSAID alternatives for pain management like acetaminophen carefully. The unexpected danger in focus medications. People with attention deficit hyperactivity disorder often take stimulant medications daily. Drugs like Adderall or Ritalin help improve focus but carry cardiac risks. A 2024 study by the American College of Cardiology revealed dangers. These patients have increased risk of developing cardiomyopathy or heart muscle weakness. Cardiomyopathy involves structural changes that reduce the heart's pumping capacity significantly. This causes fatigue and difficulty performing everyday activities with increasing severity over time. Eventually, it can progress to complete heart failure, requiring intensive medical intervention. The study found 17% increased probability of cardiomyopathy after 1 year. This risk increases to 57% after 8 years of continuous treatment. Although absolute risk remains low, it is real and demands serious consideration. Many people initiate this treatment during childhood and maintain it into adulthood. The cumulative cardiac effects over decades of use remain largely unknown and unstudied. Cold remedies that spike your blood pressure. Nasal decongestants containing pseudoephedrine or phenylephrine are commonly used for relief. They alleviate nasal congestion from colds or allergies temporarily but effectively. However, they do not treat underlying causes, but only provide symptomatic relief. These medications can have serious adverse cardiovascular effects nobody anticipates or expects. Various studies have linked their use with increased blood pressure in hypertensives. They also cause arrhythmias, potentially fatal tachycardias, and even myocardial infarctions. These effects occur in people with coronary disease and those with normal arteries. Therefore, their use is not recommended in patients with known heart diseases. They should only be used under strict medical supervision and monitoring always. The dark side of hair restoration drugs. Minoxidil was originally developed to treat arterial hypertension in cardiovascular patients. Currently, it is primarily used as topical treatment for alopecia or hair loss. It acts as a vasodilator, increasing blood flow to the scalp area effectively. However, this effect triggers a compensatory response throughout the entire body system. It increases heart rate, myocardial contractility, and causes significant fluid retention problems. This increases the heart's oxygen consumption and can worsen existing heart failure. While unlikely to cause failure in healthy people, it endangers compromised hearts. Its use must be supervised by physicians, especially in patients with cardiac histories. Diabetes pills with a deadly secret. Some drugs for type 2 diabetes are associated with increased cardiovascular risks. One of the most studied is rosiglitazone, belonging to thiazolidinediones group. Rosiglitazone has been linked with greater risk of heart failure and mortality. Compared with other drugs in the same group, like pioglitazone, it performs worse. A study from the Institute of Clinical Evaluative Sciences followed patients for years. It tracked 39,494 patients during 6 years. Those who took pioglitazone had 23% less risk of heart failure. They also had 14% less mortality than those who took rosiglitazone. The American Diabetes Association recommends avoiding rosiglitazone use when possible always. Despite this, its use is still permitted in many countries under restrictions. If you have diabetes and were prescribed rosiglitazone, consult your doctor immediately. Discuss possible cardiovascular risks, especially if you have pre-existing heart disease conditions. Blood pressure drugs that weaken your heart. Calcium channel blockers are commonly used to treat arterial hypertension effectively today. Although effective, some can have adverse effects on heart function over time. Verapamil relaxes arterial smooth muscle, reducing peripheral resistance and blood pressure levels. However, it can also decrease myocardial contractility, potentially triggering heart failure. It can cause cardiac block or sinus arrest, especially combined with beta blockers. Diltiazem has a similar mechanism to verapamil, but with less cardiodepressant effect. Still, it can cause heart failure in vulnerable patients with compromised function. Dihydropyridines like nifedipine, amlodipine, felodipine act primarily on blood vessels only. They produce vasodilation without significantly affecting contractility or heart muscle function. Nimodipine is used specifically to prevent cerebral spasm after subarachnoid hemorrhage. Although these drugs do not usually depress myocardium directly, they carry risks. They can worsen angina, cause peripheral edema, or contribute to cardiovascular events. Their use should be careful in patients with pre-existing cardiac dysfunction always. Summer heat turns life-saving pills into hazards. Summer can be dangerous for those taking beta blockers and antiplatelet drugs. Researchers from Yale School of Medicine revealed this paradoxical danger clearly. These medications are prescribed precisely to reduce heart attack risk and control pressure. However, according to Yale Department of Epidemiology studies, external factors matter significantly. Heat waves can elevate heart attack risk in cardiac patients taking these drugs. Scientists analyzed 2,494 cases of non-fatal heart attacks. These occurred in Augsburg, Germany, during summer months from May to September. Data covered years from 2001 to 2014 comprehensively. Results showed heart attack risk increased significantly when temperature rose 2 degrees. This was especially true for those taking beta blockers or antiplatelet medications. Heart attack risk increased 63% in those taking antiplatelet drugs. It increased 65% in those taking beta blockers during heat exposure. Those taking both medications combined had 75% higher risk than others. The study revealed something even more surprising about age and cardiac condition. Younger patients between 25 and 59 years had less coronary disease. However, those taking these medications had greater heat-related heart attack risk. They had higher risk than elderly patients, which contradicts typical expectations completely. The exact mechanism by which heat and these drugs increase risk remains unknown. It could be due to greater organism vulnerability or temperature control alterations. More research is required to confirm these hypotheses and understand mechanisms better. 1. Use air conditioning and stay in ventilated places during extreme heat always. 2. Avoid heat exposure during the hottest hours of the day completely. 3. Consult your doctor about treatment safety, especially in hot climate zones. Fungal infections versus cardiac collapse. Some antifungal medications can trigger heart failure rapidly and without warning signs. Itraconazole is one of them and can cause severe immediate heart failure. It can also cause intermediate onset failure appearing days after treatment begins. For this reason, this drug should only be used for life-threatening infections. Never use it for mild conditions like onychomycosis or superficial fungal infections. Another dangerous antifungal drug is amphotericin B, which also causes severe failure. It can provoke intermediate onset heart failure through mechanisms not fully understood yet. Although adverse effects are usually reversible, after stopping medication risks remain real. The risk of severe heart failure is genuine and can be fatal undetected. Its use can also increase probability of future cardiac problems significantly. Breathing easier but heart struggling. Albuterol is widely used in asthma treatment and other pulmonary diseases today. It is a bronchodilator that relaxes and expands airways to improve breathing. But albuterol should not be used lightly or without medical supervision always. This medication can decrease beta receptor sensitivity, causing potential heart failure. It can provoke moderate or severe failure, either immediately or after prolonged use. Risk depends on dosage and is greater with systemic administration like injections. Frequent nebulizations also increase risk of cardiac complications significantly over time. Malaria prevention with hidden cardiac costs. Anti-malarial medications are used to treat and prevent malaria from parasites. Drugs like hydroxychloroquine and chloroquine act by inhibiting lysosomal enzymes. For this reason, they can provoke severe heart failure immediately or later. Generally, heart failure associated with these medications occurs after prolonged exposure. It can also occur with high doses, but may reverse after treatment suspension. These drugs are also used in autoimmune diseases like lupus or rheumatoid arthritis. Their monitoring is crucial in patients with chronic treatments requiring long-term use. 7 life-saving strategies for cardiac protection. 1. Make a balance of your current condition with comprehensive medical evaluation today. Visit your cardiologist for necessary studies like lipid profile and echocardiogram tests. Also, get stress tests or blood pressure monitoring like 24-hour Holter. Everything necessary to know your heart's true state and function accurately now. If you are hypertensive, you will likely need Holter for complete pressure mapping. Once the doctor has results and makes diagnosis, they will tell you exactly what to do. Follow recommended diet, make appropriate exercise, and of course, take prescribed medications faithfully. In this consultation, ask all your questions including exercise routine specifications carefully. If you have doubts about prescribed medications, do not ignore them at all. Speak with your doctor to find the safest option, especially in hot climates. 2. Stop smoking, because tobacco introduces thousands of toxic substances damaging heart and vessels. It also increases cancer risk, significantly making smoking cessation absolutely essential today. If you cannot quit alone, seek support groups or talk about nicotine patches. Discuss other therapies with your doctor that can help you quit successfully forever. 3. Use stairs because they are free and everywhere, helping improve cardiac function daily. Just skip the elevator and go directly to stairs for simple exercise. Climbing stairs lets you see how your cardiac function performs under physical stress. If after 2 or 3 flights you cannot breathe, it signals poor condition. It clearly shows you must improve your physical condition and heart resistance urgently. Besides stairs, help burn calories, improve circulation, strengthen heart, and build resistance. The American Heart Association states adults need 150 minutes weekly. They need aerobic activity every week, and climbing stairs helps achieve this goal. 4. Care for your diet when shopping, because all diets start in one place. The supermarket requires much attention to foods you buy without falling into old habits. For heart-healthy shopping, ensure you include vegetables, fruits, whole grains, and nuts. Likewise, eliminate processed products and reduce amounts of red meat you purchase. Instead of meats, you can choose poultry and fish, or even legumes and beans. The idea is following diets low in saturated fats and refined vegetable oils. Decrease sodium consumption and reduce added sugars in your daily food intake significantly. If you follow a DASH or Mediterranean diet, it would be best for heart. These diets include many vegetables, fruits, nuts, fish, lean meats, whole grains, and olive oils. 5. Rest because having a good night's sleep is essential for better heart health. It is important to sleep between 7 to 9 hours each night uninterrupted. When you do not sleep enough, cortisol rises, causing inflammation throughout your body. This generates plaque accumulation in arteries. Blood pressure increases and eventually causes chronic conditions. Insufficient sleep can even lead to heart attack through multiple physiological pathways simultaneously. If you truly seek to care for your heart, stop losing sleep hours. Stop watching series or social media and sleep because rest is invaluable for heart. Sleeping is as valuable for heart as good diet or regular physical activity. 6. Avoid alcohol because alcoholic beverages increase calorie consumption significantly and raise triglycerides. Triglycerides are fats that favor formation of fat plaques on arterial walls. They lead to atherosclerosis, a silent and dangerous condition that jeopardizes cardiac health. Besides, alcohol is a toxic substance for heart and organism in general. Therefore, it is important to limit or eliminate alcohol intake for heart care. Frequent and excessive consumption can cause arterial hypertension and even heart failure. People with cardiac conditions should avoid alcohol completely without any exceptions ever. 7. Remember that cardiac disease is the leading cause of death in everyone. It is important to remember that cardiac disease represents high-risk condition. It can suddenly worsen and compromise life at any moment without warning signs. This risk acquires particular relevance in women due to physiological and contextual factors. Women of 20, 30, and 40 years must pay special attention to hearts. They should attend cardiology consultations and take necessary measures for good cardiac health. Remember, the female body goes through many changes like pregnancy and menopause. These demand more effort from heart, and sometimes body cannot resist pregnancy demands. This can develop hypertension, gestational diabetes, and other dangerous conditions for mothers. Therefore, it is necessary to make pertinent medical checkups during these life stages. Likewise, women have higher risk of conditions like lupus and arthritis, among others. These in turn elevate cardiac disease risk, making attention to general health essential. Regardless of age, it is essential maintaining regular medical control and supervision. Visit specialists at any health anomaly, because heart failure is serious and progressive. It is potentially mortal and can manifest even in people without previous histories. Therefore, it is crucial maintaining strict vigilance over medications you consume daily. Avoid indiscriminate use of drugs without prescription from qualified medical professionals always. If your health condition requires prolonged treatment, talk with your doctor about safety. Discuss cardiovascular safety of each drug and evaluate less risky therapeutic alternatives available. Taking control of your cardiac health today with balanced diet-adapted physical activity matters. Regular medical follow-up is not just a recommendation, but a vital decision. It preserves your heart function and your overall quality of life for years. Your heart deserves the best care and attention you can possibly give it. Every beat counts, and every choice you make impacts your cardiovascular future significantly. Start today, because tomorrow might be too late for preventive measures and interventions. Your heart has been beating faithfully for you since before you were born. Now it is time to return that loyalty with conscious, informed, and dedicated care. Make heart health your priority, and watch how your entire life transforms beautifully.